All right, part 2 of the ankle. Now we're going into muscles and movement. Kind of left off on here, but this is dorsiflexion. So dorsiflexion. Okay. And I will show you how to measure dorsiflexion here. Okay, movement of the top of the ankle and foot toward the anterior tibia. Plantar flexion, so movement of the ankle and foot away from the anterior tib. Eversion, turn the ankle and foot outward. Abduction, away from midline. Weights on the medial edge of the foot. Okay. And like we talked about last class session, it's very difficult for you to sprain your ankle with the eversion ankle sprain. Usually you'll do it with the inversion ankle sprain. Usually land playing basketball this way, and you'll do an inversion ankle sprain. So train the ankle and foot inward, adduction toward midline. Weights on the lateral edge of the foot. Toe flexion, movement of the toes toward the plantar surface. Toe extension, movement of the toes away from the plantar surface. Now, this is a funny movement, and when I teach motor control and anatomy, this is also called the Babinski reflex. So if you were to take a sharp object, like a spoon or a reflex hammer, the edge of a reflex hammer, and do this little test, if the toes fan up like this, they could have an upper motor neuron lesion. If you try it on yourself, your toes will actually curl down. They'll actually go this way. Okay, so that's normal if you were to touch the bottom of your foot with a sharp instrument. Do that. But if you have an upper motor, like a brain injury, it'll actually go up. Interesting, right? Pronation. I looked at some of your feet. Some of you have some flat feet. But it's no big deal. It doesn't always mean that you have issues, but pronation is the combination of dorsiflexion, subtalar eversion, and forefoot abduction. Okay. Some of you have really high arches. That's a combination of ankle plantar flexion, subtalar inversion, and forefoot abduction. Okay, so that's supination. And a lot of you had just average feet. So muscles, groups formed according to location and function. So you've got the anterior ankle and foot. Those are the dorsal flexors or the dorsiflexors. Posterior are the plantar flexors. This group, posterior plantar flexors, is called the triceps surae, and that would be the gastrocnemius and soleus. So in the book you might see triceps surae, but that's actually the gastrocnemius and soleus. Laterally you have the evertors, and medially you have the inverters. The lower leg is divided into 4 compartments. You have dense fascia, tightly surrounds and binds each compartment. Facilitates venous return and prevents excessive swelling of the muscles during exercise. And then I remember when we were talking about swelling, the lymphatic system does a good job of returning swelling back to this inferior vena cava. So that's why exercise is important. Pumping your ankles is important. If you take a long flight, let's say you were going to India for 22 hours. Yes, it takes 22 hours to get to India. You have to constantly flex and pump your ankles, otherwise your feet are going to get really swollen. The anterior compartment is the dorsiflexor group. So what's in the anterior compartment? You've got the Tibialis anterior, Peroneus Tertius, Extensor Digitorum Longus, and Extensor Hallucis Longus. That's anterior compartment. The lateral compartment is the Peroneus Longus, Peroneus Brevis are the 2 most powerful evertors. The superficial posterior compartment, you got the Gastrocnemius and Plantaris, which are your plantar flexors. The deep posterior compartment, which are your Flexor Digitorum Longus, Flexor Hallucis Longus, Popliteus, and Tibialis posterior. So all are plantar flexors and inverts except the Popliteus, which is responsible for that screw-home mechanism that I talked about last week. So compartmental syndrome, showed you pictures of that. That's the most common in the anterior compartment. Maybe acute or chronic, may occur secondary to injury or trauma or overuse. Symptoms include sharp pain, particularly with increased movement, actively or passively swelling, and weakness in the muscles of the involved compartment. There you go. Yeah, there you go. Nasty. All right. Depending on the severity, emergency surgery may be indicated to release the fascia in order to prevent permanent tissue damage. Many compartment syndromes may be adequately addressed with proper acute management. So if you have an athlete that complains of severe, sharp, excruciating pain, you get them to the emergency room right away after they've been hit in the thigh, hit in the leg. Any sharp, excruciating pain, that's a concern. All right. Acute and chronic injuries are very common. Shin splints. Shin splints are a common term describing a painful leg condition often associated with running activities. It's really not a specific diagnosis. It's attributed to a number of different specific musculoskeletal injuries. Usually most involve the tibialis posterior, medial soleus, or anterior tib, but may involve the extensor digitorum longus. May be partially prevented, and here's the key, by stretching the plantar flexors and strengthening the dorsiflexors. Also strengthening the glutes, glute med, glute max, but stretching and strengthening of the dorsiflexors cues. And eccentric control is of the dorsiflexors, so tibialis anterior eccentric control is important. Muscle cramps, acute muscle spasm in the gastrocnemius occur, actually somewhat common. I think someone mentioned in class, when we had class, that they get cramps and maybe relieved through active and passive dorsiflexion. So cramps are interesting, and let me show you a couple things about cramps, muscle cramps, and how to prevent them. All right. And then we talked about the complete rupture of the Achilles tendon. I showed you Kevin Durant and Kobe's injuries, disabling injuries. All right, the ankle and foot joint muscles by function. Several ankle and foot muscles produce more than one movement. You got the plantar flexors. So those are the gastroc, flexor digitorum longus, and flexor hallucis longus. So when you study for the exam or study for the quiz, put them in groups. Okay, so say, hey, these are all the plantar flexors. Peroneus or Fibularis longus, Peroneus or Fibularis brevis, Plantaris, Soleus, Tibialis posterior. They all plantar flex. Everters. You might see Peroneus or Fibularis, means the same thing. Longus, Peroneus or Fibularis brevis, Peroneus or Fibularis tertius. So let's say on the quiz, it'll say, oh, all of the following are plantar flexors except. And I might throw in like a Fibularis tertius, because you know that that doesn't plantar flex, it only everts. So I'm teaching you how to study for the exam. All right, dorsiflexors, tibialis anterior, Fibularis tertius, actually dorsiflexus. Extensor digitorum longus, or extension of the lesser toes. Extensor hallucis longus, or extensor of the great toe. Inverters, inversion. Tibialis anterior, tibialis posterior, flexor digitorum longus, or flexor of the toes, and flexor hallucis longus, flexor of the great toe. What's involved in the anterior compartment of the leg? So then you've got the tibialis anterior, extensor hallucis longus, extensor digitorum longus, Peroneus or Fibularis tertius. So again, putting them into groups. Say all the following are in the anterior compartment except. Lateral compartment, you've got the Fibularis longus and the Fibularis brevis. The deep posterior compartment, you've got the flexor digitorum longus, flexor hallucis longus, and the tibialis posterior. Superficial posterior compartment is the gastroc medial head, gastroc lateral head, and the soleus. So there's your triceps surae here. 1, 2, 3. The nerve, the sciatic nerve, tibial division, gastrocnemius, which has the medial head, soleus, tibialis posterior, flexor digitorum longus, and flexor hallucis longus. Okay. The medial and lateral plantar nerves, intrinsic foot muscles. You've got the medial plantar nerve, which does adductor hallucis, flexor hallucis brevis, first lumbrical, and flexor digitorum brevis. So the medial plantar nerve does this. Okay. The lateral plantar nerve does adductor hallucis, quadratus plantae, lumbricals 2, 3, 4, dorsal interossei, plantar interossei, abductor digiti minimi, and flexor digiti minimi. A lot of muscles in the inside of your foot that you don't realize. And the reason you don't realize it is because you're in shoes all day. You don't really realize that your feet can do a lot of things. Let me show you this cool video of this gentleman, or actually is it, let me see, that it uses her foot to paint. All right, sciatic nerve. Common peroneal or fibular division. You've got the superficial peroneal nerve, Peroneus longus and Peroneus brevis. The deep peroneal nerve, tibialis anterior, extensor digitorum longus, extensor hallucis longus, Peroneus tertius, and extensor digitorum brevis. So at this point, it's just pure memorization, right? Learning which muscles are innervated by what nerve and innervating that. Gastrocnemius, what does it do? Plantar flexion of the ankle, flexion of the knee. So here's a good quiz question. It also flexes the knee as well as plantar flexion of the ankle. So it's a two-joint muscle. But the soleus does not. It only plantar flexes the ankle. It does not flex the knee. The Peroneus or Fibularis longus, eversion of the foot, it also plantar flexes the ankle. The Fibularis brevis does eversion of the foot and also plantar flexes the ankle. So Peroneus longus and Peroneus brevis basically do the same thing. Peroneus tertius does eversion of the foot, but it does dorsiflexion of the ankle because of its attachment. So the difference between Fibularis longus and brevis is that tertius does dorsiflexion while the other two do plantar flexion. Good quiz question. All right, extensor digitorum longus, extension of the four muscles, dorsiflexion of the ankle, eversion of the foot. All right, extensor digitorum longus muscle, extension of four lesser toes at the metatarsal phalangeal and proximal and distal IP joints, dorsiflexion of the ankle, and eversion of the foot. Extensor hallucis longus does dorsiflexion of the ankle, extension of the great toe at the metatarsal phalangeal and IP joints, but it's a weak inversion of the foot. Okay, it's a weak inversion. Tibialis anterior, this is where you get shin splints. Dorsiflexion of the ankle and inversion of the foot. And the reason that a lot of people get shin splints is because they lack eccentric control and weakness in their glutes. Tibialis posterior, plantar flexion of ankle and inversion of the foot. Flexor digitorum longus muscle, flexion of four lesser toes, inversion of the foot, plantar flexion of the ankle. Flexor hallucis longus muscle, flexion of the great toe, inversion of the foot, plantar flexion of the ankle. You got a lot of muscles, intrinsic muscles of the foot. All originate and insert within the foot. Extensor digitorum brevis is on the dorsum of the foot. Remainder are on the plantar compartment in 4 layers on the plantar surface of the foot. Okay. First, which is the superficial layer, that's abductor hallucis, flexor digitorum brevis, adductor digitorum minimi or quinti. And then you have a second layer of intrinsic muscles of the foot, which are quadratus plantae and the lumbricals. So knowing the first layer and second layer is important, or what muscles are found in the first layer and the second layer of the muscles of the foot. Third layer, you got the flexor hallucis brevis, adductor hallucis, flexor digitorum minimi, and quintus brevis. And then you have a fourth layer, which is the deepest layer, which has the dorsal interossei 4th and plantar interossei 3. So just knowing which muscles are on which layer is a good quiz question, exam question. Usually they're grouped by location. So medial location, you've got the adductor hallucis, flexor hallucis brevis, adductor hallucis, and then the adductor hallucis and flexor hallucis are located medially, but the adductor hallucis located centrally beneath the metatarsals. Again, they're just grouped by location. Central location beneath the foot, you've got the quadratus plantae, 4 lumbricals, 4 dorsal interossei, 3 plantar interossei, and flexor digitorum brevis. The dorsal compartment is the extensor digitorum brevis. The lateral, attached to on the lateral aspect of the base of the 5th phalange, proximal phalanx. The abductor digitorum minimi and the flexor digitorum minimi brevis. The term quinti is sometimes used instead of minimi, so you might see quinti or minimi. Some of them are grouped by action, so 4 muscles that act on the great toe. You didn't think your great toe had that many muscles, but yes. You got the adductor hallucis, responsible for abduction of the great toe and assists the flexor hallucis brevis in flexing the great toe. Adductor hallucis, adduction of the great toe, extensor digitorum brevis, extension of the great toe at the MP joint. And you got 4 lumbricals, flexors of 2nd, 3rd, 4th, and 5th phalanges. The quadratus plantae, flexors of the 2nd, 3rd, 4th, and 5th phalanges. 3 plantar interossei, adductors and flexors of the proximal phalanges. 4 dorsal inner abductors and flexor of the 2nd, 3rd, and 4th phalanges and their MP joints. Flexor digitorum brevis. There's a lot of intrinsic muscle of the foot. So you don't realize, you never talk about, hey, I'm working out my flexor digitorum brevis. But I'm going to show you some good exercises to do barefoot that will greatly improve your balance. And you want to do exercises without socks on sometimes, without shoes on, so that you get that neural sensitivity and get that neural education. So I'll show you some exercises here. Extensor digitorum brevis extends the great toe in the 2nd, 3rd, and 4th phalanges. Fourth toe muscles, adductor digiti minimi, abducts, and proximal phalanx. Flexor digiti minimi, brevis flexes the proximal phalanx. Ankle dorsiflexion. What are your agonists? That's tibialis anterior, extensor digitorum longus, Peroneus or Fibularis Tertius. That's your extensor hallucis longus as well. Your agonists, gastroc soleus for plantar flexion, and then you also have flexor digitorum longus, flexor hallucis longus, Peroneus for Fibularis longus, Fibularis brevis, plantaris, tibialis posterior, all do ankle plantar flexion. Transverse tarsal and subtalar inversion. You got your tibialis anteriors, a little bit of tibialis posterior, but also flexor digitorum longus and flexor hallucis longus. Your agonists for eversion are Peroneus longus, Peroneus brevis, Peroneus tertius, and extensor digitorum longus. Toe flexion, flexor hallucis longus, flexion of the great toe at the metatarsal phalangeal and the interphalangeal joints. Flexor digitorum longus, flexion of the 4 lesser toes. Toe extension, you've got the agonist. What does toe extension? You got extensor hallucis longus, that's your big toe, extension of the great toe. And I think I told you in running that's very important. So extension of the big toe is very important. Extensor digitorum longus, extension of the 4 lesser toes at the metatarsal phalangeal and the proximal and distal IP joints. All right, let me show you a couple exercises here.